So today we're going to work on unsticking stiff ankles, and one of the treatment tools that I've found that's just been really just massively helpful for a lot of my patients is the floss band. In this case, I'm using the Rock Floss bands, and so today we're going to work on teaching you how to unstick stiff ankles. And a lot of times this is going to come from things happening further up the chain. So issues coming down from the hip, issues coming from the knee, or sometimes even issues that are coming up from the foot. And a lot of times the body tries to protect you by stiffening up the ankle in order to do that. But in this case, we're going to work specifically on how to improve motion in the ankles, specifically your ability to pull your ankles up. In this case, it's going to be something that's going to help you, especially if you notice that you have issues with knee pain, like in lunges, in squats, or if you just notice that one side of your running stride is different than the other and you're noticing that it's coming from stiff ankles. All right, so here we go. So in this case, we're going to use the floss band. So if I can get you to bring your leg up. So for our floss bands, we want to make sure that our wrap is tight enough that we get good compression on the body part that we're taping or that we're wrapping, but not so much that we get like a color change to anything lower. So if you're wrapping your ankles, the foot should not turn blue with this. All right. So another thing I found specifically with this is that we tend to get better results if we wrap out to in. So in this case, I'm going to go ahead and anchor above the ankle. And as I come down, I'm going to pull up. I'm going to secure the top of my band. And then I'm just going to come down about halfway, all the way down. I'm going to come over these two bumps here on the ankle. And then once I've hit those and I'm starting to get into the foot proper, I'm going to do back and forth, down over the middle of the foot. And I'm just going to continue to overlap all the way down. And I'm going to finish, close my loop off at the foot. And there's our wrap. All right, so once we've gotten our foot wrapped, we have a couple different directions that we can treat it. One of the ones that I found, especially if I'm having difficulty pulling my foot up and in, is actually going to be taking it in the opposite direction. So in this case, I'm going to take my hand over the top, and I'm going to push down and across. And that's going to be the motion that I'm going to teach Paige here how to do for herself. So again, I'm going to come over the top till you feel a stretch in the top of the joint. I'm going to take it in till I feel that end range stretch. So no pain with that, right? Mm-mm. Okay, so I should not have pain with this. If you do notice that you have pain in your ankle and you take it a little bit less than that and bring it out, you'll often notice that pain starts to disappear as I do more repetitions and bring it up and in. All right, so in this case, let's go ahead and get you to cross this leg over the other. So this foot over the other leg, all right? And so what you're going to do is you're going to take this hand, you're going to secure that there. This hand here is going to come up over the top, and it's going to pull down and across. So you want to go ahead and get that to feel similar to what I did. And so you actually want to have this hand come over that big toe as well. So bringing the big toe down is going to be key in this one for working on improving mobility. Hi, and welcome to TallahasseePT.com, home of Biomechanics Physiotherapy and Fitness. I'm Dr. Brandon, the owner and lead physio here at Biomechanics. And I just wanted to start off by letting you know who it is that we help and then how to best use this site to get the information that you're looking for.